the dose is really important. Like, you don't want to be doing, 5 grams of turmeric a day. That's ridiculous.
It turned her orange, right? Her
turned
liver
her
enzymes were
orange.
through the roof. Yeah.
All right, welcome back to another segment of my conversation with Dr. Jason FauntLeRoy. Jason is a naturopathic physician specializing in endocrinology and diabetes. He's based in Seattle and is the founder of FauntLeRoy Naturopathic Medicine. Jason's been living with type 1 diabetes for over 15 years, and this gives him a unique firsthand perspective on managing chronic disease. He completed his undergrad degree in exercise science at University of Montana before earning his doctorate in naturopathic medicine from Bastyr University in Seattle, and then completed a 2-year residency in Seattle as well. He's been recognized by Seattle Met Magazine as a Seattle top doctor 3 times. So let's dive into another part of the conversation with Dr. FauntLeRoy. I'd like to move on to what is turning into what seems to be a reasonably contentious topic, which is things like semaglutide and GLP-1s. I have gotten a lot of questions about these over the last year. I'm not comfortable prescribing them. So I generally refer folks, like I've sent a bunch of people, go talk to Jason. He knows these things.
Thank you.
But let's just talk about GLP-1s, what they are and why they're as part of the conversation. And then we can go into some of the branches of this particular conversation.
I love this conversation because you see it now on your bread. This is GLP friendly food, right? Like it's it's everywhere, right? Like there's entire like marketing towards people taking this medication. It's so popular.
It's like the wineries are putting gluten-free on the wine bottle. Like,
yes.
Are you fucking kidding me? Okay. Anyway,
yes.
Go ahead.
It's pretty cool, right? So we've been using GLP-1s for diabetes treatment for a couple decades, right? So it's not this brand new medication that I think people are just getting aware of, because it got kind of apprehended by our weight loss community, because it is really good at that. It helps lose weight. But we've been using it for diabetes for a long time, and we know its safety profile, we know its risks, and so that is something that like I can talk you through, right? Like is that what your listeners would like to hear, is kind of those details about why use it, when use it, that kind of thing?
I think the appropriate use is the right conversation to have, because I am hearing more and more of people using these things for conditions that are bad ideas.
Yeah. Okay. So diabetes, great time to use it, right? And then now we even take this molecule semaglutide and we call it something different when we're treating diabetes. We call it Ozempic, and it's the same thing. And then we call it Wegovy when we prescribe it for weight loss, right? So, but it's actually exactly the same med. So a GLP-1 is a natural hormone that our intestines produce after we eat meals, right? So you eat a fatty meal, a sugary meal, and it's produced, goes to various parts of the body and says, you're full, you're good, right? And so many of us who overeat have challenges with understanding how much is enough for us, and that problem. Or diabetes, it actually impacts the pancreas and reduces the production of glucagon, increases the production of insulin, right? So all of these good things that we want, and you just end up eating less as well because it's making you feel full. And so using it for diabetes, it's now moved up to a first line medication because it does some really good things. It lowers your blood sugars. It is heart protective, kidney protective, which we saw lots less heart attacks when people were taking it, strokes. So there's some really good benefits for people to use this for diabetes, and we've called it a first-line medication because it is so effective at doing that. And it also won't send you low hypoglycemic like a lot of the other meds will. So like sulfonylureas, insulins, those medications have the risk of sending you too low and actually having some real dangerous adverse effects. GLPs will stop when you get to a healthy spot. So there's some times to use it for diabetes that really make a lot of sense. And then you also have that side effect of weight loss, which is great for people who have diabetes, right? Like those two things go hand in hand. So that's the appropriate time and place to use it. We can use it for weight loss, but then we're start talking about the idea of medically necessary, right? Are you healthy at that weight that you were in, or is this something that's being apprehended for a cosmetic reason that is actually a tool of abuse for some people, right? I have to screen for eating disorders prior to having this deeper conversation, right? I don't want people to be in a place where they're only eating a half a meal a day, and that's a really non-nutritious meal anyways. That does not scream good health to me as a provider. So,
I don't think
yeah.
people are doing these with the intention of there's so much psychology actually wrapped up in this conversation. And there's this whole social construct that says, and I'm just going to name it, people, women in particular, have to look a certain way. And so I think it is ripe for abuse with the wrong marketing campaign, from using it as a weight loss drug, that it'll be used for people that don't necessarily need it for weight loss and would garner greater benefit by looking at diet, lifestyle, and a good mental health provider.
Mm-hmm. Mm-hmm. I mean, with that said, here's where it could be useful from a physiologic standpoint. Resetting this kind of abnormal gut-brain axis where you're not feeling satiated, we could use it to reset and help you figure out what it is to feel that normal hormone that's supposed to be produced and get you kind of to a place where this is what I'm supposed to be like. That's where I could see it being really useful for that particular use.
That's a really good reminder. So thank you for saying that. I don't think people realize how complex this whole cascade of hormones that have to do with eating is. And we've thrown out a couple of words that people may not understand. I think everybody's heard of insulin. A lot of people have heard of glucagon. I think most diabetics have heard of it because don't a lot of diabetics carry around glucagon pens?
Mm-hmm. Yep.
Is it an emergency? But there's leptin and ghrelin and like all these things that go into, am I really feeling hungry? Like, do I need food, or is it this hormone imbalance that makes me think psychologically I need something to fill the emptiness? But that's a great part of the conversation, and I don't know that we're going to get there with an answer anytime soon, because it is so complex that I don't know that we have a complete answer. But yeah, again, I'm in support of anything that helps reset and helps somebody get off of it and onto a healthy diet and lifestyle following.
Absolutely. And with that said, there is black box warnings, right? Like there's real risks associated with it. So making sure that the right people are taking it and we're not abusing it is our job as physicians, is to really screen for that. Make sure, it has that black box warning, which has in theory, the risk of increasing thyroid tumors, right? And so while that was only in rat studies, we're just cautious with it, making sure you're doing testing of thyroid and things ahead of time, making sure that people know you can really slow down your digestion and get gastroparesis from it. And some people just don't even tolerate the medication to begin with. They are so nauseous that it's not worth it to them to continue. Yeah. Others tolerate it really well, right? So we got to use it for use the right tool for the right job.
Yeah. This is a good time to segue into a different part of the conversation. And you and I have talked about a little bit. We may not have a great answer for this right now, but as the research comes out, it'll be interesting to see where this goes. I had a patient recently ask me to prescribe GLP as a microdose for reducing inflammation. And I thought that was a really interesting thing. Like microdose is all the rage these days. Well,
I know it.
We know that a lot of medications are biphasic. Higher doses can have different effects from lower doses. Psilocybin and cannabis are classic examples of medicines that have different impacts at different doses. What are your thoughts on a microdose of a GLP-1 and if that might actually be effective, and is it a good use of the medication?
Love the idea personally of microdosing, but then I always like to see what the research says too, and it's just not all there yet, right? So I can't give like this definitive answer, but it seems like, at least physiologically, a little bit of something that kind of helps you reset this satiety piece could be very helpful for someone, right? And then reduce the side effects accordingly. So at least in theory, it sounds great. And trying it with patients with, obviously the risk parameters in place has been a lot of fun just to see where we can get to. We used to compound a lot of this semaglutide when there was a big national shortage. And so we were using the oral tablets long before the new oral tablets just came out, and they were less effective, but they still kind of got people the weight loss that they wanted. So, it was a different way of administering it. And I think that that's kind of an example of that.
Okay. How do you determine what a microdose is?
I know. Great
Right?
question. It takes time. I suppose research, everybody putting data together to come up with the right dose. And I
Yeah.
suppose this one's probably different because we're talking about based on an individual's weight. I think, I'm seeing a lot higher doses for people with GLP-1s for people who have more weight because they need more of the hormone. So it might change based on the individual.
Okay. One of the things that we have not talked about in this conversation as two naturopaths, which is like interesting that we're already this far into the conversation and all we've talked about are pharmaceuticals. I want to know about herbs. I want to know because, there is diet and lifestyle for sure, but naturopaths have traditionally used a lot of plant medicine to help with these conditions. How does that fit within the model of your business? How do you use those tools?
This is where the magic happens. This is where the fun is, right? Because we have lots of different medications for diabetes, and you get to be really creative and find the ones that fit. There are a ton of herbs just like that are all quite effective. And, right, sometimes plant medicine isn't strong enough or it's a different modality. The herbs that we have, like berberine, there's tons of them, and they have some really great impact. In fact, sometimes I'm able to take people who are on meds and slowly taper them off those meds while I slowly bring on berberine in kind of place of it. And this berberine has this nice side effect. It's an herb that we use to kind of help with GI stuff as well. So sometimes people find their gut microbiome improve. They see their cholesterol improve along with the diabetes, and it's just an herb, right? So it's been pretty cool to see. I've even seen people go too low on their numbers with berberine. So it's that potent. And so is that the right fit for you is really what I love discussing with patients. Like if your A1C is a 14, probably not. It's not going to do enough by itself. But in adjunct or maybe for someone who's pre-diabetes, it has wonderful efficacy. And then there's tons of Chinese herbs that I'm just getting into. You could probably speak to those
Oh,
ones. I love learning, but I can't pronounce them. I don't always know what's in some of these formulations. But I had a patient who was on a Chinese formulation for his diabetes, and I kind of said, I don't know what they are. I can't really recommend. And he came off of them and his numbers went way up. And so I'm
mm.
seeing changes to people's A1Cs drastically from just herbal products. So chromium, selenium, there's micronutrients that are absolutely impactful for people lowering their diabetes numbers, right? Like there's a lot of cool and actual research evidence-based products that can be used. I know exactly how much this berberine is going to bring you down. It's going to bring you down about this much on an A1C, and that's scientifically studied. So it's kind of cool to be able to know when you can use any of the tools that are at your disposal for treatment.
Are you a fan of The Pit at all? Do you watch The Pit?
Love it. I love that. It's a
Oh my
wonderful
God.
show.
I can't. We just watched the last episode that came out, and they had the woman on who was orange,
Yep. Yep.
and it's the first TV show I've seen where they said the word naturopathic doctor on it, and of course, there's that obvious. One doctor is absolutely slamming alternative medicine, and then the voice of reason comes in from the other doctor. Is like, well, what was the dose? And these things can be useful in the right doses. And I was like, oh my God, it's about time somebody actually framed that conversation in a balanced and fair way, because these herbs are effective, but the dose is really important. Like, you don't want to be doing 5 grams of turmeric a day. That's ridiculous.
It turned her orange, right? Her
Turned
liver
her
enzymes were
orange.
through the roof. Yeah. Oh, yeah. Well, this is the fun of the job that we get. I get people on supplements all the time, and they're afraid to tell their MDs sometimes, or they don't tell them that they're on these things. And they come to me and I say, oh, you're on how much vitamin D? Right? Like that's a fat soluble vitamin and gets stored in the body. And I do some testing and find out, oh my gosh, they have toxic levels of vitamin D in their system because they misunderstood how much was normal and natural. And that's where we get to come in as the professionals and just help calm this down and understand exactly where the therapeutic dose, where it's safe, where you're actually going to get benefit from it. I love doing that. I love helping. I do whole supplement visits where I do a Zoom call with someone and they go through their cabinet and show me everything that they have. And I love that because it helps them understand the why behind what they're taking and the science.
I love those visits too, because it opens up the door for, do you really need this? And here's how you can eat it instead of take it in a supplement.
That's great.
I get I'm so amused by medical doctors that say herbs are dangerous. Like, yeah, in your hands, yes, they are.
That's true. For you, it is. Yeah, that's great.
Yeah, but if you're educated in these things, they can be very powerful tools.
Love it. Yes. Amen.
Oh my gosh. I have one more because this is where I'm going with this. The show, like making fun of people. Every time colloidal silver comes up, you're familiar with colloidal silver. For those who are not, it is a traditional antimicrobial thing. But every time colloidal silver comes up, somebody says, "Oh my God, it'll turn you blue." And it's like, well, if all you did was drink colloidal silver all day, yes, you're going to turn blue. But if you have a dropper full of this stuff, it's not going to turn you blue. Like, knowing the right dose and knowing how to use something, even in the naturopathic world, is really crucial.
Absolutely. What's that old saying? The difference between medicine and a poison is the dose.
Totally. That's one of the reasons I love Eric Yarnell so much. For those who don't know, Eric Yarnell is a naturopathic physician in the Seattle area, and he is a master herbalist, has an herb company called Heron Botanicals. Anyway, he taught our herb class, and in particular, the low-dose herbs, the ones that are dangerous, like aconite and belladonna. And he's like, do not be afraid of these things. They are therapeutic tools. And every time somebody says an herb is dangerous, I've got Eric Yarnell whispering like, no, just, you got to know how to use it.
He reads the research and he knows the data, right? And he's phenomenal. I would recommend reading everything of his, everything.
Absolutely. Okay, so we're kind of nearing the end of the second part of the conversation. I think my takeaway from the GLPs is they're absolutely fabulous tools for the right people, and they can do wonders for folks who need system resets in their hormonal physiology as it relates to eating and that sort of thing. However, working with an appropriate provider for an appropriate use is probably a really good idea.
Absolutely. And this is what I get is a lot of people come to me and I explain to them the side effects. They have never heard of those side effects before, even though they've been on it from somebody else. And that's an important piece, is I think our system gets really busy and doesn't always tell them the risks. And then they feel like, I wish I would have known that at first so that I could have made an educated, smart decision. Because ultimately, this is the patient's journey, right? Like, they get to make the choices. And I'm here as the guardrails. I'm here as an advisor, but I'm not here to circumnavigate and tell them you can or cannot or have to do certain things. And I feel like giving them that space, that education, is the most important tool that we can give them, especially about something that feels a little controversial, like a GLP.
Yeah. The education piece, again, to circle back on that, I think a lot of patients do get a stack of paperwork that they take, so they've been prescribed a new medication and it might be in there, but they may not. I think a lot of times people just need somebody to explain it to them.
Yeah.
So taking the time to say, this is what this is what it's doing, and this is, if you're open to it, this is how we can get you off of it in the future.
Absolutely. Love it.
All right. Thanks, Jason, for the first segment in our conversation together. He and I have extended our talk into another segment. So if you'd like to listen to the next part of our conversation, please click on the link below.